Good afternoon, folks. This is Robert Chappell, Executive Editor of Madison365, with your daily update for August 11th. We will have, after the break, we're going to go through the COVID numbers for today. We'll do that pretty quickly, and then we'll get to my interview with Dr. Sheryl Henderson. Unfortunately, we taped that this morning, so it's not a. I would love to have it a live thing where you guys could ask her questions, but we just, she's a practicing physician and very busy. So I took the few minutes that I could get, and she has a lot to say, a lot of really important stuff to say, a lot of confirming fears, frankly, on some things related to Delta variant. So definitely stay tuned for that. You will want to be, I don't know, you'll just want to stay tuned for that. But first, let's talk about the numbers for today. As was the case yesterday, there's good news and bad news. Okay, good news is that the positive test rate, the percentage of tests that have returned positive results in the past 7 days, fell again to 7.2%. That's still a very high number. Did I say 7.2? I meant 7.1. 7.1%. It was 7.2 yesterday. And on Monday, it was 7.4. Okay. So again, we don't want to look at any number in isolation. We want to look at trends. And that number is going down. That's the right direction. Only for a couple of days now. It's not a huge trend, especially that it was rising sharply, not just rising, but rising really sharply, like a half a percentage point every day for almost 2 weeks. So to have 3 days where it's kind of going slowly downward, not reason to celebrate yet, but movement in the right direction. The other number that's not moving so much in the right direction is the number of average cases per day, which is now 1,121. That's 20 higher than yesterday, and that is driven partly by another big number today, 1,316 new confirmed cases in the past 24 hours. And again, the fact that that's going up, but the percentage of positives is going down means more people are getting tested, which is generally speaking positive. It is not easy to get a test, unfortunately, but it's not impossible either. Right? You do have to make appointments at Walgreens or CVS or whatever. There's a handful of pharmacies around town, around the state, that will do a drop-in test. They want you to pre-register. So that's one of the bad news things, is that we kind of, as a state, decided testing wasn't going to be that big a deal anymore. We just had to focus on vaccinations, and now we're finding testing is actually going to be pretty important after all, as it turns out. We are seeing a slight increase in vaccines, excuse me, that's kind of the best news of the day. Although it's been around 7,400 doses per day, which is up from like the 5,000 or so that it was uh, earlier in July. It did drop off a little bit today, actually. It's just under 7,000 per day now as a 7-day average, which is still good. I mean, we'd rather see it closer to 10,000, 15,000 to really move the needle on vaccines. But right now we are at 52.9%. Wisconsin has gotten one dose, 49.8 have gotten both. So we're very, very close to halfway vaccinated, right? Which should be offering some level of protection for the population. It's not quite enough. There's still 3 million people that aren't vaccinated. And Dr. Henderson will talk a little bit more about that in a few minutes. One other note that I'll mention is, the CDC classifies, low disease activity, medium, high, and very high based on primarily based on the number of new cases per 100,000 residents. And right now we have 68 out of our 72 counties are considered high transmission, and 4 are considered very high. And unfortunately, this doesn't really tell me easily which 4 counties those are, but I'll see if I can find that for you. Okay, that is, I think. Oh, one other thing: hospitalizations have also been going up, and the Wisconsin Hospital Association says that its data was updated today at 3:30 p.m., which was an hour ago. But it's exactly what it was yesterday, including the daily increases, which wouldn't if as of yesterday there were 525 people hospitalized with COVID infection. If there were still 525, that wouldn't be shocking, but the 1 day increase would say 0, right? If it was the same as yesterday, but the 1 day increase says 44, which is what it was yesterday. So I think this data just did not get updated properly, which is fine. The bottom line is that people are being hospitalized. Hospitalized population is going up around the state, not so much in Dane County, but around the state it is going up quite dramatically. Well over 50% in the past week. So we'll get a better update on that probably tomorrow, which is fine. So we're gonna take a short pause and hear from our sponsor, and then we'll be back with Dr. Cheryl Henderson. I'm serious. If you want to be informed, if you want to answer questions, if you want to help answer questions from people who are asking you about vaccines versus masks versus whatever, stay tuned for this conversation with Dr. Henderson. It's really, really important. So we'll be back right after this.
I wasn't sure if it was the right time.
Then I heard about the College Try.
You take classes for 7 days, see if it works for you.
No obligation, no worries. I kept going. I'm so glad I did.
I wanted to do online classes, but I didn't have a computer. The Madison College hooked me up.
You can borrow a college laptop and a Wi-Fi hotspot.
Seriously.
My dad always says, give it the old college try.
For real, give Madison College the college try.
Try Madison College risk-free for 7 days.
No commitment.
Just try it.
Like a free trial for college.
Like, why wouldn't you?
Why wouldn't you?
Why wouldn't you?
And joining the program today, Dr. Cheryl Henderson. She is a pediatric infectious disease specialist with UW Health, also affiliated with hospitals Unity, Point Health, Meriter, and SSM St. Mary's. Dr. Henderson, thank you so much for joining us today.
Well, thank you for having me. It's a pleasure to be here to talk about this very important topic.
Yeah, thank you. First of all, we're seeing this surge of coronavirus infection and spread nationwide, also here in Wisconsin. Are you, as an infectious disease specialist, are you surprised by this?
The answer is no. In terms of those of us who understand viruses, that we do know that the surge, the cases that we're seeing now are caused by this new variant, the Delta virus, and that viruses change overall. And so that this has been one of the concerns that we've had overall.
Talk about that Delta variant. We hear a lot about it, and can you just, is it, my understanding is that it is more contagious than like original COVID. What does that mean exactly? How much more contagious? Can you put some context around that?
Sure. So, about a year ago, when we were looking at the original SARS-CoV-2 virus, we would talk about contagiousness being that R naught value, that if there was one person who's infected, they might, in certain situations, infect 1 or 2 people. And with this Delta variant, what we are seeing now is that put in the same situation, same number of people, proximity, that one person carries much more virus in their nose, and they're able to infect 6, 7, 8 times, 6, 7, 8 more people than the original virus. So, the numbers vary in terms of contagiousness, but I've heard anywhere from 6 to 10 times more.
Wow. Okay. That's concerning. Is it also then more likely to affect children?
Yeah, we're in a setting now where the people who were most vulnerable a year ago, those seniors, people over age 65, are now vaccinated.
Sure.
So, we are seeing more cases among children, but that can also be impacted by the fact that they are not able to be vaccinated now. Right. And that, a lot of, over the summer, there were more kids perhaps getting together than they had during the school year when everybody was separated. So we are seeing children infected, especially relatively more infected, but there's many variables in that.
Yeah, sure. Now, what are you seeing in your practice as an infectious disease specialist? Are you seeing more kids or just more cases, or are the cases any different than they have been over the past year?
So locally, there's not anything specifically different, but we are hearing from colleagues around the country, especially in states and counties where there is a lot of community spread of this Delta variant, that there are more children being admitted to the hospital and admitted to the intensive care units.
Do you think, is it possible that that you haven't seen a big upsurge in hospitalizations of kids here locally in Dane County? Could that be possible because our community is relatively more vaccinated than other places, perhaps?
That is a possibility. You know, for an outbreak to occur, the virus has to be introduced into the community.
Sure.
And we do know that the Delta variant is definitely the predominant one here also.
Yeah.
But we do know that vaccinations protect those who are not vaccinated. So if there's more people vaccinated, there's less opportunities. And that mitigation.
Yeah, yeah. We'll talk a bit more about vaccine in a minute, but I also want to ask about testing.
Right.
You know, it's not. We don't have the big community testing centers. We don't have like the 3-hour wait at the Energy Center to get tested anymore.
Right.
It's a little bit harder to get tested. But who should get tested? Should we all be getting tested once a week or something, or what are the circumstances that would lead a person to get tested?
So the main circumstances are definitely people who are symptomatic.
Sure.
So that means that's similar to what we've seen before: runny nose, cough, sore throat, headaches, fevers associated with that. If there's symptoms that could be COVID, that's an indication for testing.
Mm-hmm.
If somebody has been knowingly exposed to somebody with COVID-19, then that's an indication for testing. And then, as we know, there's international and travel requirements that require testing.
Sure. And then let's talk a little bit about vaccine.
Mm-hmm.
Obviously, you know, we're in Dane County, we're ahead of the game, and with areas of Wisconsin and nationwide are struggling to you know, get up to that level where we need to be. What would you say to somebody who's just sort of hesitant? You know, who maybe wants to, I just want to see more people get it. I want to get the full FDA approval,
Right.
Whatever. What do you say to folks like that?
Well, I think in conversations, it's always important to know, as you said, why people are hesitant overall.
Oh, sure.
What we are seeing now, though, with the Delta virus is that it's really changed the game in many ways, and that with this virus spreading so rapidly and primarily sending those who are unvaccinated to the hospital and into intensive care units, that the urgency for vaccinations is here much more than it has been in the past. And the vaccines are still safe. They're still very effective in terms of preventing hospitalizations and intensive care unit stays and death.
Does Delta variant, we hear that Delta variant can infect those who are vaccinated, that vaccinated
Mm-hmm.
people can pass it along, but, you know, more so than previous iterations. Is that true? And what are the numbers around that? Do you have any sense?
So, yes, this Delta variant is different than the previous variant. So we do have to think about it differently. Okay. And what we've learned in the last couple of weeks is that the virus that's in our noses is the virus that of an infected person. That's the virus that can be transmitted. Yeah. And so there were studies that looked at the levels of virus in vaccinated people and unvaccinated people who've been infected, and they are the same, and they're high levels compared to the original virus. So even though the vaccinated person may have only mild symptoms or no symptoms at all, that they're potentially able to transmit just as efficiently. I mean, we still don't have all the data on you know, how long, and but we do know that there's infectious virus in the nose of vaccinated people infected.
So the vaccine protects you from getting severely ill or hospitalized or dying, but doesn't necessarily stop you from spreading it to other people, which leads me as a layman, and tell me if this is the right conclusion, to, even though I'm fully vaccinated, I should probably have a mask on just to protect other people. Correct.
Right? This is where the Delta variant has really changed the game again, is because masks, we do know, we've learned a lot about universal masking, and masks do help prevent the spread of virus from the infected person to those around them.
What does a mask have to look like or be like to be effective? I mean, just like a regular sort of cloth, one of those sort of fashionable ones that people have, or should we all invest in the N95s?
Well, the cloth masks are they're effective as they're double cloth, and the test is to hold them up to the light to see if you can see through them.
Oh, okay.
You do want to be able to breathe through them. The main thing for the cloth masks, as well as the more filtering procedural medical style masks, is that it's a good fit. You want to be breathing air on the outsides of this overall. Yes, N95s are the most effective in preventing these viral particles overall. But
Got it. All right. What else do you think folks need to know at this moment? I mean, people are scared. People are concerned, especially as school is going to start up again.
Right.
A lot of schools are requiring masks, which is great. But then there's also a lot of people who are angry at the unvaccinated. There are unvaccinated folks who are angry that we got to do this all again. This is really not that big a deal. What do you think people just kind of need to know, or maybe kind of don't quite understand enough, or how we should be approaching this research?
You're right. There is a lot of fear. There's also a lot of misunderstanding and a lot of misinformation. So I think it's important for people to be listening to programs such as yours, or talking to people to ask, what are the true facts about this? And it can be scary when, 2 weeks ago, guidance changed because we learned more about the Delta variant.
Right.
But for this variant, I think it's important to know that the vaccines are effective. We do know that 99-point-something% of people who are dying of COVID are not vaccinated.
Right.
It's important to talk to healthcare providers. We've learned that people trust their healthcare providers rather than sometimes going to the media. So that's an approach to take. The one thing that I think that we are concerned about, and this is the nature of viruses, as we're seeing with the Delta virus, is that it can to change as a community. So vaccination is our best tool to stopping another variant that might be even harder to control. Masks are very effective. We've shown that over the last several months in settings with universal masking that can slow the spread of virus, especially in school settings where if all the kids and teachers and staff were masked, outbreaks were prevented for the most part.
Good.
It had to be.
Yep. Okay, good. So you heard it here, folks. You need the true facts. You need to hear from the experts, and there's nobody more expert than an infectious disease doctor who's been doing this for 20 years, Dr. Cheryl Henderson, right here in Madison. Really appreciate your time today, and appreciate you helping us understand this stuff more. So,
and thank you for all you do for getting the information out.
Very good. Thank you so much. Sorry, for those of you who are asking questions, that interview was previously recorded this morning. We found 15 minutes in her very busy schedule earlier today. So I'm sorry we weren't able to do to take questions live. But for Jean's question, talk about boosters for people who have compromised immune systems. Just before I came on live today, I got an alert from CNN that the FDA is expected within the next 48 hours to approve booster shots for people with immune compromised conditions. So I don't know if that means your particular doctor would recommend it. but it looks like it's going to get FDA approval to get a third a vaccine booster, basically. Aaron asks about young kids playing soccer, basketball, etc. That's a terrific question. I can pass that question along. Maybe we'll have Dr. Henderson on again next week, and we can collect some questions for her. We'll have a little bit more lead time. But my everything I've heard is that that even for kids and even doing sports, like outdoor activities, just aren't nearly as risky. That's the what I've heard. I would obviously defer to Dr. Henderson on that question, but that's just what I've heard. Okay, so that is that's thanks again to Dr. Henderson. We'll get now to some other local news. We've got lots of good stuff at Madison365.org, as always, including a profile on Amado Rodriguez III, who has been a restaurant worker and a cook for years and years in restaurants all over the place. And like everybody else in the food service business, like almost everybody else, at the beginning of the pandemic, he was out of work suddenly and down to his last nickel, as he puts it. And just to get by, started selling tamales from his front yard, making, and being able to bring in like $100 a day was basically enough to eat a little bit and buy more ingredients for the next day. And the tamales must have been good because word got around, and pretty soon he's making $400 a day. And now, a little over a year later, A-Rod's Tex-Mex Grill is open over on Madison's East Side. And he's got like a legit real live restaurant over there, Tex-Mex cuisine. And there's some photos. I was just preparing to do this. I was just looking at the story that Dave Dahmer did for us on Madison365. I'm sorry, not Dave. Naomi Wolf wrote the story, and the photos will make you hungry, for real. So go take a look. Madison365.org has all that story. It's a terrific story of perseverance and overcoming a very difficult situation. And I will definitely be trying it out next time I'm on the east side. Also today, we've got a preview of Juju's street ball tournament and block party. Now this is a photo that Dave Dahmer, our editor, took back when he worked at Madison Times, and probably like 10 or 12 years ago. This event, this street ball party and block party, the street ball tournament and block party has been took place for a long time at Penn Park, organized by Johnny Winston Jr., who Madison folks will know, former school board member, president of Firefighters Union, longtime firefighter, Sable Flames guy. And he just, as he got older, had kids, had more responsibilities, just wasn't able to organize this event anymore. Some other people tried to do it for a year, and then, and this kind of died. And a former Southsider, and I gotta check his, make sure I get the name right. Julian is his first name. Let me make sure that I get his name right. Julian Walters grew up on the South Side, played for the Southside Raiders, played in the street ball tournament, and went away, played college basketball, is now back, and really wants this event to happen again. So he's reviving the event. He's bringing it back, and it's coming this Saturday. You can still get in on it. You can still put together a team, play the street ball tournament, enjoy the block party from noon to 6 down at Penn Park. And finally today, Reservation Dogs is a new television program, FX on Hulu. So you need Hulu. It's $5.99 a month. But it's this is a show by Taika Waititi and Sterling Harjo, who is a indigenous Canadian comedian. Taika Waititi, from Thor Ragnarok and lots of other movies. It's a story of 4 teenagers who are sort of a gang, not really a gang. They're trying to trying to escape to California from the reservation in Oklahoma. They're trying to get together some money. Sometimes they do so legitimately, sometimes not so much. Little petty crimes here and there, and it's a remarkably interesting story because it's made for and by indigenous people, right? You think about indigenous people in movies, right? They're always written by white people, and they're always like revered and romanticized and not particularly real, right? But this is written, performed, directed, created by indigenous people. And what I liked about it, what I noticed about it watching it, there are 2 episodes available now. There's going to be 4 more coming in the next 4 weeks. But that it just presented, this is indigenous life on this reservation in Oklahoma. It did not stop to explain anything to me, right? So, which I appreciate. So I just kind of put out a call yesterday. Any local indigenous folks watch this show? What are your opinions? I got a whole bunch of feedback. Tricia Zunker from the Ho-Chunk Nation Supreme Court, Arvina Martin, here in Madison, an alder person who's a member of the Ho-Chunk Nation, a couple other Ho-Chunk folks, just universally saying like it's just so nice to see us represented authentically, right? And it's funny, and it's not about, as the way Arvina put it was, it's not trauma porn, right? It's not just about, oh, look at these people so stoically suffering. They're Native Americans, and they're being funny, and they're having problems, and they're having successes, and all sorts of, it's just a normal life for these folks. So anyway, the story is on Madison365.org. The local reaction in that story is a trailer, like 2-minute trailer for the show, and also how to get it. I recommend it. It's on Hulu, which is $5.99 a month. And you can, if you wanted to, you could also just wait till September 6th when the last episode airs. Sign yourself up for a free trial. Watch the whole thing and cancel. That's how you cheat. All right. That's all I have for you today. Once again, appreciate Dr. Cheryl Henderson. I would urge you, share this episode just for that interview with Dr. Henderson, because she was so helpful in helping me understand it and helping me understand just how much worse Delta variant is. You hear it said it's worse, whatever, but you don't know how much of that is kind of fear mongering and how much of that is real, and it's real. And she was able to articulate that really well. So I appreciate her joining us today. I encourage you to share that episode as often as you can, as much as you can. And if you appreciate what we do here and want to support it, you can join the fam at Madison365.org/thefam. That is our membership program. You can join for as little as $5 a month, up to $25 a month, and you can be a member of our family and support the work we do. All this, it's free for you, but it's not free for us to create this journalism and to keep it professional and to keep it going. So join the fam if you're so inclined, if you're able. Other than that, have a wonderful evening. Stay safe out there. There are still tornado watches around. Sounds like we might be in for some hairy weather here and there. So stay safe. And we will be back tomorrow. Same time, same place. Talk to you soon.
This is 365 Media.